Hello and welcome to the topic of hypothermia by Dr. Ignacio Skoll. So, what is hypothermia? Hypothermia is a condition in which the body's normal thermal regulatory mechanisms are unable to maintain heat in a cold environment, and the core temperature falls below 35 degrees Celsius. The normal core temperature is actually around 37.7 degrees Celsius. So, what are the risk factors for hypothermia, especially in infants? Infants are high risk for hypothermia because they have poor thermoregulatory mechanisms. There is a high body surface to weight ratio, thinner skin, and they have low subcutaneous fat. Elderly, hypothyroidism, alcohol, and drugs like phenothiazines. Uh, and other risk factors are glucocorticoid insufficiency, stroke, hepatic failure, and hypoglycemia. So, classification of hypothermia, it can be classified as acute, subacute, and subchronic. Acute hypothermia occurs when core temperature falls rapidly, example immersion in cold water. Subacute hypothermia, example hill walking during cold temperatures. And subchronic hypothermia, when it develops in an immobilized older individuals, especially in the background of uh, conditions of immobility such as stroke. So clinical features of hypothermia are mild hypothermia, 35 degrees Celsius to 30 degrees Celsius. There is cold and shivering, confusion, dehydration, and ataxia. In severe hypothermia, 32 degrees Celsius to 28 degrees Celsius. The person is cold, but he is not shivering. And there's a depressed conscious level. There is vasoconstriction in the blood vessels subscribing the muscles. There's bradycardia, hypotension, and the ECG shows J waves and this. So you may be wondering what these J waves are. J waves are response waves seen in severe hypothermia. That is indicated by the blue arrow. There is a rhythm of atrial fibrillation, and there is bradycardia. There is QTC prolonged, but you can see the J waves between the QRS waves and the ST complexes. There is this J wave, and in this case, the patient's core temperature was at 24 degrees Celsius. And in this ECG also, you can actually see J waves in between the QRS and ST waves. If you look at the previous figure and compare it with this, you will see J waves, especially in the V3, V4, and V5. J waves are clearly visible in these three leads. I repeat, in V3 it is more clearly visible, in V4 and V2 also it is slightly visible. So clinical features of hypothermia are for severe hypothermia below 28 degrees Celsius, the ECG picture still stands, there is coma, there is absent pupillary reflexes, the patient may appear dead, there is loss of corneal reflexes, and it might lead on to cardiac standstill. So investigations can be blood gases, full blood count, electrolytes, chest X-ray, ECG shows J waves and cardiac dysrhythmia, AST and CK are elevated, and investigations into the causes especially important like thyroid dysfunction, pituitary dysfunction, hypoglycemia, and drug intoxication. So management of hypothermia, patients should be rewarmed in a controlled manner. The treatment of hypoxia by oxygenation and ventilation if necessary. There should be treatment of fluid and electrolyte disbalance, treatment of cardiovascular abnormalities, particularly dysrhythmia, careful handling of the patient, and rewarming. In case of mild hypothermia, if the patient is outdoors, we will shelter the patient from the cold, replace the cold weight clothing, cover the head, and insulate him from the ground. If there is effective cardiac output, then first year rewarming with heat packs placed in axilla, groin, and around the abdomen. The patient is given warm air to inhale, and rewarming rates are at 1 degree Celsius to 2 degrees Celsius per hour. If there is hypothyroidism, then 10 microgram IV triiodothyroid is given 3 times a day. For severe hypothermia with cardiopulmonary arrest, rewarming should be more rapid with over 2 degrees Celsius per hour. This is achieved by cardiopulmonary bypass or extracorporeal membrane oxygenation. If both cardiopulmonary bypass and extracorporeal membrane oxygenation are unavailable, veno hemofiltration And pleural, peritoneal, thoracic, or bladder lavage with warm fluids can be done. We also monitor the cardiac rhythm and arterial blood gas, including the pH. Thank you, and please subscribe to Ignatius Gold for more upcoming medicine videos.